Recording in
who
progress.
are being documented to be positively exposed to the Ebola virus. So it affects not just health, but directly the economic productivity of that particular community. But we are also very happy to note that there have been recoveries since last time. 45 cases in total have now recovered and have been integrated back into their communities. And we are doing very active contact tracing. We have listed now 1,000.
To upgrade me to panelist.
We have now listed 1,800 contacts across 9 districts. Of these, 50% have come of those who are getting off the list after completing their 21 days. So far, we are also quite pleased to note that the contacts that are actively being traced, we are at 96% of the contacts that have been listed. We know where they are. They have been appropriately educated, and they are really following the advice and instruction of our health workers so as to limit the number, the risk of transmitting it beyond the immediate areas. So we are working very closely with the government there. We have been asked to train and deploy village health teams. These are individuals who will be going out into the community, making sure that the community fully understand what Ebola is, how to prevent it, and how to behave if someone is suspected to have or has been exposed to a case. And this very active part of the response is the most critical, because it engages with the community directly. And we expect that with this expanded engagement into many more health districts in Uganda, we are going to have the numbers coming under control. The government has requested Africa CDC to do several items, and we are pretty much on the path to initiating or implementing all that we've been asked to do by the government of Uganda. The Ebola virus disease is still only in Uganda and has not spread to any part outside of that country. Thirdly is monkeypox. Since the last briefing, a total of 38 new cases and no new deaths have been documented in 3 countries, Cameroon, Liberia, and Nigeria. The majority of those cases in Nigeria, 31. And this is a 3% decrease in the number of new cases that have been confirmed compared to the last briefing, which is a good sign because the numbers are going down. Now, when we look at the last 1 month, we see that we documented a 49% increase over the 4 weeks. But over the last 1 week, we are seeing that rate is now dropping. Cumulatively, from the beginning of the year, in Africa, we have documented 6,870 cases with 173 deaths, which gives us a case fatality rate of 2.5%. We are losing nearly 3 people for every 100 that have been infected, and this is not a good situation. 13 of our member states have been affected, and although we are seeing a decline in the number of cases across all affected countries, we need to continue to be very awake to the fact that the pattern of spread of monkeypox has a cycle. So we are very much supporting our member states to continue to be able to engage with members of the public and do laboratory testing, including managing the cases in a way that does not result in any spillover into the rest of the community. Fourth public health event I would like to share today is yellow fever. This, since the last briefing, 14 new cases and 1 death have been reported in 2 of our countries, Kenya reporting 2 cases and Niger 12 new cases, and 1 new death. From the beginning of the year, cumulatively, we have seen 2,876 cases and 15 deaths across 8 of our member states. When we compare the situation over the last 2 months, and we're using a larger time period because of the number of cases, this will give us a good trend analysis. We see that there has been a 62% decrease in the number of new cases. And this decrease is largely due to the preventive measures that have been put in place, vaccination, although it is reactive to the affected communities, but vaccination is being done, and information also to members of the public how to handle the situation with yellow fever. So we are quite happy with that trend, and hopefully we'll be able to corrected so far, and we continue to support all who have active cases